Go.
Sound good?
Yeah, we're good. Starting.
You start. Alright, so today we did our presentation on concussions. It was by me, Zach Rodriguez, Nico, who just so kindly walked across the presentation, and Neika, who you will see later on in the video.
Okay, so the first thing we're going to talk about is what a concussion is, the background information on it. A concussion is a blow to the head that disrupts the normal functions of the brain and makes simple tasks very difficult to do.
Some stats on concussions. Over 300,000 concussions are sustained each year in sports. Over 62,000 of those concussions are from high school contact sports such as football, soccer, field hockey, ice hockey, wrestling, those types of sports. The number of concussions in football are comparable to the number of concussions in soccer. That means if you play soccer or football, you're just as likely to get a concussion no matter which sport you play. It's just the nature of the game, unfortunately. In one season, 60% of college soccer players reported symptoms of a concussion at least once during the duration of the season. People who have had concussions are 4 to 6 times more likely to sustain another concussion, meaning that if you get one concussion during your playing career, during the remainder of your playing career, you are 4 to 6 times more likely to sustain a concussion if you sustain a very impactful hit or blow to the head, which can lead to a concussion.
And the next we're going to talk about are what are the short-term effects of a concussion. Some symptoms are headaches, blurry vision, trouble balancing, nausea or vomiting, dizziness, delayed answer to questions, bad memory of event or events after the incident, like say you got a concussion, you won't really remember what happened before and after the incident. Confusion, trouble retaining information, looking like you're in a daze, and sensitivity to light and noise.
Some sports that I can't turn, as I stated earlier, just some examples are soccer, football, hockey, lacrosse, field hockey, ice hockey, boxing because of the punching and the blows to the head, wrestling because you're being slammed up against the mat, and lacrosse and football, it's just the nature of the game. You go and you hit each other, you get blows to the head. And soccer, because of the heading, and you go up for a header and you can hit the opponent that you go up for a header with. Partridge stated that an estimated 20% of all mild traumatic brain injuries are sports related, meaning that the total amount of concussions sustained in a year, roughly 20% of them are through contact sports.
Okay, so next we're going to talk about concussions in the sport of soccer. Like you just said before, headers are really common in soccer. That's when the ball is in the air and you hit it with your head. Multiple headers in a row can lead to a concussion. Also collisions with the opposing players. For example, if two heads clash when they're going towards the ball, that can lead to a concussion. And some long-term effects can be caused by multiple blows throughout a player's career. So for example, if you play soccer, you play multiple seasons with a lot of headers every season, that can lead to more long-term effects down the road. And maybe even be seen during players' careers, but they don't go unnoticed because they think they're very mild and they don't take it as seriously as they should.
Concussions can occur, like I said earlier, in football and hockey. Partridge stated in his findings that retired football players are found to have 3 times more mortality rates from neurodegenerative brain diseases than the regular population, meaning that retired football players that play football in pads and helmets for an extended period of time are found to unfortunately pass away 3 times more than your average person. Junior ice hockey players from Canada get 21.5 concussions per 1,000 collisions, which is a 3.3 times higher rate than expected according to CARE. More concussions means if you're out of the game a longer time with each concussion, with your post-concussion syndrome getting worse and worse each time. So the first time you get a concussion, it's a week out of the game, you don't do anything, you skip school, no phone, no video games, no TV, no nothing. And then you work your way back with the concussion protocol with high school professional athletes and college athletes. They have a concussion protocol you have to follow. After that, each concussion, the time out of the game and the time to come back increases with each concussion that you sustain during the run of play.
Okay, so these are just some short-term effects of concussions. Soldiers who screened positive for TBIs, 85% of the soldiers that tested positive for TBIs reported dizziness, headaches, memory problems, and this is found in Morissette's article. Depression, anxiety, isolation, confusion, and suicidal thoughts, and difficult transitioning back to normal life after their career is over. Those are found in Karen's articles.
Treatment for concussions are pretty simple for the most part. Don't go to sleep after the head injury is sustained, just for the simple fact that if there's a more serious brain injury and you go to sleep and you don't wake up, people will often leave you alone when you're asleep. So there's an extended period of time from the brain injury, worsening before anyone even notices the injury has worsened. You go to the doctor as soon as you think there's a slight possibility that you may have a concussion. So if you experience headaches, dizziness on a regular basis, or trouble balancing, you need to go to the doctor and get tested for a concussion if you're an athlete. Try to avoid any light exposure during when you have a concussion, because it can delay the process of returning to play. Don't use electronics because of the light. Don't go back to school right away because that can hurt your brain. You're not absorbing the information, and the noise of the classroom in the hallway can hurt your head and also delay you coming back. And last but not least, obviously listen to the doctor because he knows what's best for you, and he just wants you to get back as soon as possible and get back to 100%.
Okay, so next we're going to talk about long-term effects of having a concussion. Short-term memory loss is the first thing that you experience. Confusion, depression and aggression, suicidal thoughts due to the pain, not feeling like your normal self, and chronic traumatic encephalopathy, otherwise known as CTE.
Which was found in Junior Seau, the football player shown on the right side of the screen. He was found to have CTE after he committed suicide in the early 2000s after his playing career was over. Chronic traumatic encephalopathy, like Nico said, is also known as CTE, which is what you'll often hear it referred to as. It was founded by Dr. Amalu in 2005. According to law, more than 70 brains have been donated for study in patterns that show that the most damaged parts of the brain are the cerebral cortex and the medial structures of the limbic system. Once again, according to law. Symptoms of CTE include the following: early dementia, forgetfulness, punch drunk, most common in boxers, drug and alcohol abuse, which people use because for them it relieves the pain, the confusion, and the hurt, knowing that they're slowly deteriorating on the inside and they don't know why. You can have trouble sleeping. If you sleep well normally, you can have trouble adjusting to retirement. So after your playing career is over, you have trouble getting back to everyday life. Like you forget your kids' names, where you put your shoes, where your phone is, even though it's in your pocket, where you put your keys, even though you could be near the key rack and forget where everything is. This is often found in players. Dementia is related to neurodegenerative brain disease, which can also get crossed up in the diagnosis of CTE. CTE is a result of a protein called TAU protein, or PTAU, which deteriorates the brain. It is found in roughly 30% of athletes exposed to repetitive brain trauma, according to Askin. So people who play the sports we listed earlier, such as football, soccer, hockey, boxing, lacrosse, and wrestling, they're 30% more likely to get CTE than your average person.
Okay, so next we're going to talk about the different stages of CTE, according to Askin. The first stage involves headaches and problem concentrating. The second stage is depression, memory loss, explosivity. The third stage is executive dysfunction, trouble with like doing everyday tasks, like you said, finding the keys, cell phone in the pocket. Stage 4 is aggression, dementia, and language disturbance. More than 70 brains have been donated for study to analyze CTE and like how to like prevent it. And patterns show that the most damaged parts of the brain, like you said before, are the cerebral cortex and medial structures of the limbic system. Okay, so next we're going to talk about is CTE that's commonly found in soccer players. This is going to be according to Hales. Players had always been detail-oriented.
Hales did a study on a specific soccer player. He was a striker or a forward and a forward in Europe for 16 years with over 300 games played. People who had known him prior to his passing knew that he had always been detail oriented. After he retired, his symptoms worsened. He had trouble talking, finding the words to use, memory loss, disorientation, all symptoms that we stated earlier. When he went to the doctor, all the head scans came back normal, and they said, "You're fine. Just give it a little while." After 6 years of this going on, he went to the doctor again. He got diagnosed with Alzheimer's. Alzheimer's, as most people know, it's a degenerative brain disease, often found in elderly people, which is where they start to forget everyday tasks, where they put everyday items. And in my family, it got to the point where the person in my family who had it didn't recognize herself in the mirror and thought there was a stranger in her room. After 10 years of this going on, the player passed away, and when they did an autopsy on the brain, they found CTE was the result of this.
Okay, the next thing we're going to talk about is how to prevent concussions from happening.
Due to the high statistic numbers that we mentioned earlier in terms of athletes who are experiencing concussion throughout different sports, on the next slide, we've mentioned ways in which athletes can go about preventing themselves from experiencing a concussion. 1. Try to avoid any contact with your head to any hard surface. If you play a sport, be smart about where you hit your head, where you place your head when you go in for a hit. For soccer, don't lean in first with your head into your opponent's chest. Use the proper equipment needed to protect the head in any case of an event. Follow the concussion protocol to prevent yourself from being injured. The next slide, we've broken down protection in soccer. The U.S. Federal Soccer states that athletes below 10 must not practice headers, and those above 10 shall only practice headers in practice and not in games. No headers until middle school. Always wear headgears. As seen, only goalies often wear headers, but districts such as Chatham are making it mandatory for all players to wear their headgears in soccer. Teach the kids to chest the ball or let it drop to the feet. In the next slide, protection for baseball. In baseball, we don't often see a lot of concussions, but it is important for athletes who play baseball wear their helmets, because oftentimes concussion in baseball take place due to injuries to the head from the kneecap as athletes slide into the base. Prevention in football, the most important in most common sports where injuries occurred. It is important that athletes always wear their helmets at practice, at games, scrimmage, everything. And it's also important that coaches are aware of the risk of symptoms of an injury. 2009, the NCAA made it mandatory that any athletes who've experienced injuries to the head, such as concussion, do not return to practice until clear by a professional health care. And in conclusion, it is important that coaches inform their athletes in terms of the safety for football and the risk of being concussed. Thank you.
And here's what we're excited. Thank you.